Good morning and welcome to Inquirer Live. I'm Trudy Rubin, Worldview Foreign Affairs columnist for the Philadelphia Inquirer, and I'm delighted to be joined by Dr. Ezekiel Emanuel, one of the country's foremost experts on dealing with COVID-19. We'll be talking about the most critical issue in the 2020 election campaign, where this country stands with the pandemic, why things have gone so badly, and what the next president must do to get the virus under control. I can't think of a more urgent topic or someone better equipped to discuss it. Before we get started, I want to go over a few housekeeping details so you know how to participate in today's event. At any time during the discussion, you have the opportunity to submit questions for Dr. Emanuel. To do so, please click on the black bar below that says View Comments and type in your questions. If you're on social media, you can visit us at inquirer.com/TrudyLive to submit your questions. Please keep them brief and to the point because we have a very large audience and I'd like to get to as many questions as I can during the Q&A period. Without further ado, I'm delighted to introduce Dr. Emanuel. And if he looks familiar, it's because many of you will have seen his frequent commentary on CNN and MSNBC. Dr. Emanuel specializes in bioethics, a field that addresses ethical issues in healthcare and medicine, among other areas. He's the vice provost for global initiatives at the University of Pennsylvania, co-director of the Health Transformation Institute at UPenn, and on leave as chair of the Department of Medical Ethics and Health Policy. And in the Obama administration, he served as special advisor for health policy to the director of the Office for Management and Budget in the White House. And I can't forget this. He's also the author of Which Country Has the Best Health Care. It's a heavy tome, but it touches on one of the most important issues underlying the pandemic. So we couldn't have a better expert to discuss the issue that may be the decisive factor in the election campaign. And before I get to the discussion, I just want to remind you about the questions. Once again, click on the black bar below that says View Comments and type in your questions. Now, very conveniently, the debate last night had a huge chunk on the issue of COVID-19. And as we all saw, President Trump said once again that the virus would soon be gone, while Joe Biden said we're facing a dark winter. How would you describe the situation at present? Where are we in the progression of the disease?
Well, President Trump said we're going to turn the corner. He didn't say what we're going to turn the corner into. And the fact is we're going to turn the corner into a bad, we don't know how bad, late fall and early winter. And we do know that the CDC is projecting mortality to go up. If we continue at the current rate, that's 1,000 to 1,100 people dying a day, which is tragic. That adds, call it 70,000 more deaths. That brings us close to 300,000 COVID confirmed deaths for the year in the United States. And it's hard to see how we're going to go better, the way the president said. You know, he has repeatedly downplayed the severity of this illness, said by summer it would go away, and made all sorts of predictions, every single one of which is wrong. The fact of the matter is we're going to go indoors, and we know that transmission is increased when you go indoors, large groups of people for prolonged periods of time where there's coughing, sneezing, yelling, singing, and those kind of activities. A lot of that is just per force going to happen in the northern climates as we get further into towards the end of October and early November. just because of the cold. So I do think, as all experts, I included, the numbers are going to go up. As the cases go up, the mortality goes up 2 or 3 weeks later, and that's really what we're looking for. So President Trump is wrong that we're turning the corner into a better time. We're certainly going to have worse times. How much worse? Very hard to actually say at this moment.
I want to get to what you think a President Trump in a second term would be likely to do and what you think President Biden should do. But before I get there, I'd like to go back a little bit to February and March. Knowing what you know now, what were the key mistakes that the administration made? And what should they have done that might have left us in a very different place now?
Well, that's an interesting question, Trudy. And I would say, first of all, the only thing that our perspective today says that would change things back then is that the president knew very, very early from Peter Navarro, as well as his intelligence services, that this was going to be serious and potentially devastating. And so he could have acted as early as January. But we knew in February and March that we had a serious public health emergency, that it was a respiratory virus that could go around. Exact magnitude, hard to tell because we didn't know its case fatality rate, how many people would die for each case. We didn't know how infectious it was, but we did know we weren't going to have a vaccine rapidly. We weren't going to have therapeutics rapidly, and that the only intervention we have that could be effective against this was public health interventions that were well known. The social distancing, the stay-at-home orders, the limiting crowds, and then in April, early April, the importance of the face masks. The problem with and then also having a testing and tracing regime to limit spread. The problem with the administration is they did not rapidly and immediately institute the measures. If you go back and look at me, but many other public health experts who were writing in mid-March to mid-April, all the things we should have been doing were spelled out. There is no mystery, and we weren't the only ones. There were plenty of people in government, from Tony Fauci to many of the people, career people at CDC, who were saying the same things. And so the problem was that the administration and this president refused to implement them and refused to take the time in March and April to get the testing regime in order, to make sure we could do millions of tests a day, to get the contact tracing regime, and to keep the country unified and moving, implementing the same public health measures, and only slowly, in a phased manner, releasing them. It was each state for itself, a very conscious decision by the president. I'm not responsible, put it on the states, that led to a haphazard patchwork response that, frankly, kept the case rate up and the mortality rate up.
So if there had been a national strategy instead of throwing it to the states, how might that have made a difference? I mean, for example, a country like South Korea, their public health system, they got all the small manufacturers who were making masks together, and they gave them instructions. You're going to make masks, and here's how they're going to be distributed. Could the president have done that, or the health agencies under his direction have done that with masks, PPE, and with tests? Could they have gotten the private labs together and said, come up with the best test, the fast test, and a distribution system that got the tests where they were needed, and not went state by state with shortages here and surpluses there?
Absolutely. You know, we have something called the Defense Production Act. The president can, for national emergencies, step in and not just ask, but command companies to produce things that we need for whether it's PPE or testing. There's also other issues. You don't need to go to the command mode. They could have guaranteed say, the testing companies much more money so that it would be in their it would be an incentive for them to shift more and put in more equipment and train more people. They took a long time because they were worried, well, are we going to invest in this and then suddenly the market's going to disappear and we're going to lose money? So there are many things that they could have done. And as you point out, you needed coordination at the center, and the center in any situation like this where you have to coordinate many government agencies, private companies, and the states, that has to be at the White House. There's no other place it can be. And they needed a good management strategy. And if there's one thing we know about this administration, they can't manage anything. And it's not just COVID. You can look at everything that they've done. They can't keep focused on a task, manage and graph out what needs to be done, resolve bottlenecks. And that's a fatal flaw. I early on said, just imagine if Franklin Roosevelt were in control, or Lyndon Johnson were in control, or Barack Obama were in control, or Bill Clinton, you would have had, task force on PPE to resolve those problems and do what South Korea did. Task force on testing, task force on ventilators, task force on therapeutics, task force on vaccine. You would have had all of it. The only thing that they seem to have coordinated reasonably well and done a good job on is the vaccines. They had Operation Warp Speed. It seems to have been the least politicized of the responses. And all we can say is it seems to have done a reasonably good job. I think there are some problems with it, but compared to the testing regime, it's great. I mean, we're still, we're just under 1 million tests a day here, and we're 9 months into this pandemic. That's horrible. We should be at 5-10 million tests a day, and we don't seem to be able to get out of our way on this issue.
One more question on presidential leadership. From what you've looked at abroad, how important is communication from the top? One clear message, whether it's from the top leadership like Angela Merkel did, or whether it is from the public health leadership like they did in South Korea. How central is the need for one clear message?
Again, Trudy, your question answers itself. The CDC had a emergency response communication package, which they've prepared, and documents and manuals on this. And that's absolutely right. And by the way, every politician knows that's absolutely right. You need one message. You need everyone in government re-emphasizing that one message, and you need to repeat it often because the public isn't necessarily, all of the public isn't necessarily tuned in. And by the way, you have to get the states to adopt the same message over and over. I remember, I think it was Richard Nixon who said, you say something, you say it a second time, you say it a third time, by the 7th or 8th time, you're sick of it, and you're sick of saying it, and the public is just beginning to hear it. And the same, we know that that's true for all sorts of things, including public health measures, which, let's face it, are not something people want to hear because they're uncomfortable. They require changing their normal routines of life. So you have to repeat it. You have to make it very clear. You have to make it very simple. But I also think it's not only the messaging. Here's a really good thing that the government was planning to do, but President Trump and some people, political appointees, canceled. The post office was going to send to every household in America 5 masks. Now, that is a great both communication strategy. Masks are important. We know we've just sent you 5 free ones, as well as a good, effective public health strategy, and you would follow it up with more. That wasn't done, and that was a terrible missed opportunity to communicate, but also to give people the wherewithal to address the issue. Some of my colleagues from the University of Pennsylvania and I wrote an op-ed about, how we have to make mask wearing, not stigmatize it, make it the norm, make it easy for people to do, get the barriers out of the way. And sending 5 masks would have been the start, but it wasn't implemented, unfortunately. And that's a leadership issue.
So, focusing on leadership, if President Trump is reelected, what would you expect to happen with COVID-19 in this country?
I think we're going to have a lot more cases, sometime eventually in the second half of 2021. I've said November. I think that's probably still as good a prediction as any. We will have enough vaccine out there and enough other interventions that probably we can begin really reopening and returning to what we would call normalcy. That includes schools open, people being able to go back to offices, restaurants with indoor dining. But that's at the back end of 2021, and I think there'd be a lot of chaos between now and then, because they've shown themselves, as I said, President Trump has no management experience himself. He portrays himself like this great businessman, but it's not management. And management is more than, rhetoric. You have to have good communication and good, clear messaging, but you also need to identify the processes, identify the potential bottlenecks and gaps and fill them, and coordinate with a lot of people. And he hasn't demonstrated his ability to do that at all. Every management issue is handed off to Jared as if Jared has had success in any of them. It's just been terrible. In March, he handed off testing to Jared, and it's still a miserable failure.
If Joe Biden is elected, what would you advise him to do right off the bat to try to turn the corner on this before we get to the point of having vaccines readily available?
Well, I think you need probably a 4-part strategy. Part one is, as you pointed out, communication. You need a clear message, and you need to embody that message. And Joe Biden already does that, wearing the mask to that debate last night, waving the mask and saying we need people to wear it, but also having his whole cabinet do it, not having big crowds and big speeches, limiting the number of people that he interacts with, just embodying all those public health measures and repeating them. Second, I think part of that communication strategy is very much having the scientists and the trusted public health officials come forward, depoliticizing all of the communication so that people can begin to trust the factual basis on which they're being told to do these various things. So there's that communication strategy. Second, there has to be, as I pointed out, this management strategy. You actually need to appoint task force to each one of the areas and get them working. You need to coordinate with the states and to get them working. You need to make sure and upgrade the technology we have for tracing people, contact tracing people, because we're also going to need that same technology to know how many cases we have, know where outbreaks are, but also know who's gotten a vaccine and know who needs a second vaccine. So there's a lot of technological issues that need to be upgraded and maybe even created in this process. You need to make sure that all the supply chains, whether it's for PPE or vaccines or therapeutics, are in place. We've already seen glitches with this, manufacturing facilities, et cetera. So that all has to be solved. And again, the locus of control has to be in the White House with, a main person or task force, and then these subsidiary task forces. So I think that's a second area. Third, you need funding. You got to work with Congress to both fund these initiatives around the vaccine or the therapeutics, but also support the American public as they're going through this bad moment so that they're not tempted to break the public health measures. They're not forced to go to work, even if they're sick and worry about having COVID, or not get tested because, yes, the test is free, but that appointment at the urgent care center, that's not free, and I don't have $200 to pay for that. And so I think there's a whole funding approach that needs to be solved. And the last thing is there's a sort of build public trust, make sure that the person you appoint to CDC is a respected person who's not politicized. Make sure the same thing is true at the FDA. So I think there are lots of big and small things done that have to reassure the public, make the vaccine data totally transparent, not just for these first few vaccines, but all the way through as you're reviewing each vaccine, because we're going to have a lot of vaccines coming before the FDA well beyond November, December when the first ones enter, because we've got J&J, which won't report till early 2020. Merck is coming later with a potential oral vaccine. So I think there's going to be a long-standing effort to build up public trust. So communications, management, funding, and public trust, I think, are the major areas to focus on.
Trust, that's a big word in this whole operation. You know the figures. I think the latest study I saw said only 40% of the public is willing to take a vaccine. You have anti-vaxxers on the right, you have distrust on the left, and in minority communities, and especially should Trump stay in office. So that's a big obstacle to overcome. Even if Biden were elected, how do you manage that and make sure that the vaccination campaign will be successful?
You're absolutely right. And, trust is lost in a moment and it takes time to build up. But there is a strategy, I think. It begins with being transparent about the data, making the deliberations of the advisory committee that met yesterday, October 22nd, available so people hear what they're thinking, understand how they're thinking about approval of a vaccine. When data becomes available, both on how effective it is and on the side effects, make that public so people can see. Make the calculations of the statisticians, Tony Fauci's opinion, as well as other trusted people's opinions available to the public. We also need to, by the way, various minority physician groups have set up their own commissions that are going to look at the data that are available. And I think you have to embrace that. You need multiple messengers to send the same message. When a vaccine, if it gets approved, you have to have trust building measures. The president, the cabinet have to very publicly take the vaccine and communicate that they think it's safe and effective. I think you're going to have to work with the medical community and the nursing community. Again, the kind of people that the public trusts for medical information so that they can communicate to their patients that, yeah, you really should take it. I've looked at the data. I've been convinced it's safe. So I think it's got to be a multi-pronged approach going forward. And we can't expect overnight people are going to flip. But I do think, once we get a lot of stories out that, yes, it might cause some pain, there might be some fever, there might be some muscle aches, but it's worth it. And there's nothing dreadful that happens. I think people will be reassured. And you'll see that there's a whole group of people who are sort of in the middle, undecided, hesitant. You have to convince those hesitant people to take it. And I think that has to be the target. And again, it's a prolonged communication, trust building exercise. You also have to get, by the way, influencers, celebrities, sports stars, all of those people to lend their good name to the same initiative.
Before I get to questions from our viewers, I want to ask a couple of questions about trade-offs. If it's going to be some months, even in the best case scenario, before vaccines are readily available at insufficient numbers to make it safe to go back to normal, in the meantime, people are getting a bit desperate about work, small businesses, and also about schools. So let me just start with schools, school openings. The New York Times has a story today that says the bulk of the evidence up till now suggests only limited transmission from young children to adults. And in Britain, the Netherlands, and Sweden, where schools have been kept open, there's also been limited transmission among younger kids, or from them to their parents. Do you have any thinking on that? I mean, given the incredible psychological and learning losses from keeping kids out of school, what's your take on that issue?
Well, we wrote an op-ed, I think now 2 months ago, 10 weeks ago, urging the opening of schools because, just to go over what are the advantages of school. Learning, obviously, most of us learn better in person than online. I'm a professor, I teach online. It's good, but it's not the same as in person. I'll just say that. I do think I give it a sort of B+ compared to in person. There's the socialization, especially for children, being with their friends, working out. Working out social dynamics is a key part of what you learn as a child. There's nutrition. We know that schools provide a lot of essential nutrition, especially to lower income kids. And there's, monitoring for the psychological and welfare of kids and a potential.
Your mic. It happens. Bear with us, all of you who are online, often on Zoom or other platforms. You know this happens. So Dr. Zeke will fix it, and he'll be back in a moment. In the meantime, I think it's encouraging to hear what he has to say about schools, because I think one of the most difficult aspects of taking the right steps to control this pandemic is that the price is becoming increasingly high.
Can you see me and hear me?
I can hear you now. So back to what you were discussing. It's a gremlin. It's the Russian. But
you do worry about that, I have to say. I have had an Iranian hacker go after me. So schools. So we argue that there are a lot of activities that are doable in schools. So the first and main most important thing is you need a low rate of cases in the society that you're doing. And as you point out, as the New York Times points out, we've learned, and my own research with universities suggests that classroom is not where the transmission happens. That's not where this is occurring, because you keep people, it's a monitored environment, you keep people spaced away, you wear masks, you pod them up. All of that helps tremendously, and all of that actually reduces transmission. You can even put plexiglass between the teacher and the students. So that classroom activity, if you can de-densify it, works well. You obviously also have to have, especially when we're no longer filtering. So that's key. Socialization, again, the best way to limit spread is to keep people in pods and limit the number of interactions. So they're focused on 10 or 12 kids rather than everyone in the class or everyone in the school. And use outdoor spaces to the extent that you can use outdoor spaces with heaters, with coats and whatever. And I think all of that is doable. And places like Boston that have recently gone back online, it's because the community spread in Boston went to more than 1,000 new cases a day, and that made it very difficult to be safe in a classroom. So again, social distancing in classroom, wearing face masks, hand hygiene, disinfecting all the materials, and then doing that in a place where you've been able to drive the transmission rate low enough so that there's not a lot of cases to begin with potentially coming into the schools. And that can work. I mean, we've seen around the world it works. Many parts of the US it can work. But that means we've got to get the number of cases in communities down low. That's not true all through the Midwest, whether it's North Dakota, South Dakota, Wisconsin, Missouri. So those are places that, it's probably not safe to open up schools, but in other parts of the country, it is safe to open up schools.
I'm going to start getting to some of the questions that people have asked. And one of them is about the number that Trump keeps quoting of 2.2 million lives saved by closing down travel from China. Could you do a riff on that number and what it was and whether it means anything?
It certainly means nothing. And the second point to state is he closed travel. He likes this is the thing he comes back to. I did this and no one else was for it. First of all, I think as Joe Biden pointed out in the debate last night, 40 other countries had done it before he did it. He wasn't first to the party at all. Second, he didn't close down travel to China. That is false. There were hundreds of thousands of people who came in after he supposedly closed it down. Citizens came back and other people came back to the United States. So it was not at all the case that he closed down travel as claimed. This did not, it might have, what he did might have saved some lives, but it's not 2.4 million lives saved because he didn't do what he had claimed that he actually accomplished. The border was porous, the flights were porous, and many people came in after he supposedly stopped China. He stopped direct flights from Chinese, but that leaves lots of other people, including American citizens from China, coming back without adequate protection. And many of you may remember the chaos at the airports, flights coming back from Europe, flights coming back from China. New York, that doesn't look like it turned out to be a person from China. It turned out to be people from Europe coming back to the United States. So closing China didn't seal anything in the United States. It just changed maybe the locus of where the first, and maybe by a week, the first outbreak would happen, but hardly changed the course of the event. Much more important has been the president's failure to introduce the public health measures that we've been talking about that reduce transmission in a systematic way. And we and others now have published data. We published almost 2 weeks ago data in JAMA showing that compared to Italy or other highly impacted countries, after the first wave, we've had tremendous excess deaths. Compared to Italy, we've had, on a per person basis, 90,000 more deaths than we should have had. We followed the same public health interventions Italy followed. That's almost half of all our mortality. Could have been avoided if we had done the right public health measures in March and April and kept them ongoing throughout the country.
And that figure, the 2.2 million, that was just a projection if we did nothing, right?
Correct. I mean, this is constantly, some of us who've put out figures if the country doesn't respond. But the fact is that even when the public officials like President Trump don't urge the public to respond, the public looks around, they're not stupid, and they do respond. They stay at home. They have distance. Now you see a lot more people wearing masks, even though President Trump, you noticed at the end of the debate, refused to put on a mask, came in without a mask. And so the public has adopted many of these public health measures. And you're right, Trudy, that assumes nothing, but nothing wasn't going to be the situation. And I would just remind the audience, in Sweden, they did have some public health interventions, contrary to many people's claims that they just let the vaccine run rampant. In fact, they closed high schools and colleges. They limited the public gatherings to 50 people or less. They actually did a lot. The public adopted a lot of these public health measures when voluntarily, when it became obvious that it was dangerous not to. You can't say the counterfactual is not do nothing. The counterfactual is what does the public do on its own.
That leads to a question that I have here, which reads, since I live in Pennsylvania and have followed mask guidelines, social distancing, and the like, I keep wondering, how is it that so many people are getting sick across the country? Is it that they aren't doing these things, or is it more than that?
Uh, it largely is that they're not doing these things, and I would just remind you, the upper Midwest, North Dakota, South Dakota, that had among the North Dakota's the biggest per capita outbreak. South Dakota's up there. A large number of them, Sturgis happened. What did Sturgis do? Well, you had this motorcycle meeting, 500,000 people. Yes, a lot of it was outside, but people were going into diners, into stores, into hotels, into lobbies. That creates the nidus of spread. Yes, it didn't happen when the rally happened. It happened, 4 to 6 weeks later. That's exactly what you would predict. And it's also that there's some very nice programs. I mean, the programs are nice, the data are not nice. That, in fact, this is unfortunately a red-blue phenomenon. I think Vice President Biden mentioned this in the debate. Early on, it was blue states that were affected because of travel and globalization. So cases came in from Europe into New York. You had New York, Connecticut, New Jersey, Pennsylvania, other nearby states affected that were blue, but that they instituted the public health measures and they really drove cases down, and they have stayed down. They're now picking up because of the indoor phenomena. But it was the red states that sort of flaunted all the public health measures, famously Georgia and Florida, but the Midwest saying, look, it's not here. Why do we have to do these things? And now you can see that over time, there's been a shuffling of states, and it is almost at the top, exclusively red states. Nevada, I think, is the one exception that have very high rates of cases, and are soon going to have very high rates of deaths as a consequence. And the reason is they denied that it would come to them. They're either we're rural or we don't have the cases, and they flouted all the public health measures. So it does happen that if you think you're immune and you behave like you're immune and you ignore the rules, it's going to come to your community. That's the nature of a pandemic.
In other words, herd immunity, letting it rip, is not the answer?
Boy, you're going to get me started and really, really upset. So the first thing to say is herd immunity, letting it rip, is not a strategy. It's a non-strategy. Second, there's been no widespread case of where that has worked. Zero. So it's not a proven strategy at all. Third, just imagine we get herd immunity by letting the virus go through the population. Well, the estimates are we need about 200 million people or so to get infected to get herd immunity, and assuming that immunity is of long duration. 200 million people, assuming the case fatality rate is something like 0.5%, means 1 million deaths. That's the cost of doing it that way. That just doesn't seem like the right approach. And by the way, for those of you who are listening who are over 65 or might have a comorbidity like diabetes or obesity or heart disease, right? You are at way higher risk of being one of those people who dies. So it's not a good strategy, and it's certainly not a good strategy for older people or people who have some kind of illness.
Thanks. Dr. Atlas, never mind. A couple of people have asked whether you think Bidencare is a better plan than Obamacare. As much as we know, and some of it was discussed at the debate last night, what's your thinking on that?
Well, we certainly, the unfortunate situation we're in now is we have about 10% of Americans without access to health insurance. We have a situation where the number of people losing their employer-sponsored insurance is going up as more people get laid off. And especially in the 12 non-expansion states, places like Texas and Florida and North Carolina and Georgia, and by the way, with Wisconsin, they're not eligible. Many of those working age people are not eligible for Medicaid, and therefore are going to be uninsured. In the current situation, because the Supreme Court allowed non-expansion Medicaid states, we have a situation where we don't have a path through the Affordable Care Act to universal coverage. So Joe Biden is trying to plug some of the holes of what the Affordable Care Act did. Increase subsidies so people can buy richer plans with lower deductibles. Decrease the Medicare age down to 60, so people in the 60 to 65 age range won't be excluded. They're particularly vulnerable both to COVID, but also to being laid off and not being rehired. Then also creating this public option so people, especially in the non-expansion states, have a way of getting coverage, even if it's not through Medicaid. I don't know that that's certainly a viable path forward to help ameliorate the uninsured rate. I don't know that it would be my preferred method, because it's, I think, important, not to benefit those non-expansion states. We've recommended, my brother and I wrote an op-ed about recommending that we federalize Medicaid, create one national program. You can then think about how to simplify the system. Our system has become so complex with so many different programs. It's easy for people to fall between the cracks. And by the way, for providers to game the system instead of playing fairly. So I think, that's another approach. What can get passed through Congress is also a major consideration.
Right. Have a question asking, do we need to worry about future mutations of COVID-19 that can end run the vaccines currently being developed? And let me add to that, how do we prepare for future pandemics?
Those are two different questions, and they're both big questions. So your questioner is right. You got to worry about mutations, but it does appear that unlike some viruses, for example, HIV or influenza, the coronavirus does not seem to be mutating as rapidly, and those mutations don't seem to be getting it to a more severe case, or maybe preventing it from being the vaccine working. So it's a little unclear that the mutations are going to be a problem here. Obviously we won't know for sure until we get a vaccine and we see how it works. I would say a bigger problem or a bigger worry is that for some reason, the immunity to coronaviruses seems to be, compared to other things, relatively short-lived. And how frequently people need boosters is going to be a big question. So what health officials call durability of the vaccine, how long before you need a booster, that is a big question, which we don't know the answer to. Future pandemics, preparing is a big issue, and one that we need a lot of thought of. Obviously, one of the major things is we need more monitoring. The Trump administration is, I guess, now infamous for taking down our monitoring facilities. It was a great cost-saving measure, so great it cost us 220,000 lives and will cost us hundreds of thousands of more lives. That's terrible. We need, obviously, better thinking through scenario planning so we know what to stockpile and in what quantities to stockpile. We need better coordination internationally. Pandemics are not things that just happen to one country. They happen internationally. And by the way, withdrawing from the World Health Organization is not a good way to facilitate that international collaboration. I think President Trump is trying to blame someone else for his failures and conveniently pick the WHO. WHO may not be perfect, but nobody in this whole pandemic has been perfect. I don't know any individual or group that's batted 1,000, and everyone's made mistakes of prediction, of planning, but places have done better, and we can look at places that have done well. In my book, I point out that Taiwan has done remarkably well for a variety of reasons. One of which is they were suspicious of China. They actually have a health card. So when you go to the doctor, they swipe the card. They know that you're going to the doctor in real time. They know why you're going to the doctor. They were able to use that data to effectively test people, isolate people. In our country, we don't have real-time data. And I think that's one of those public health technology initiatives we have to undertake. Can we get more real-time data about people using the healthcare system? Do we need a card for everyone so that we can actually get this kind of real-time data instead of waiting, 3-6 months to know what's happened in the healthcare system? It's hard to believe we're in the 21st century, given the delays in data we have and the clear understanding how vitally important it is to have good data to make plans. But we're way behind in that in our public health infrastructure.
I've had a couple of questions about something that's a little vague, but you might know what they are referring to. A group of doctors and healthcare professionals who signed something called the Barrington Agreement that are COVID deniers or
they're not COVID deniers. So Barrington Agreement is named after Great Barrington in Massachusetts, and a group of them got together. I don't know the full details, but a group of them got together and issued this declaration, and the declaration is basically let the virus go, let's not lock down, that's been too costly, and instead we should get more natural immunity out there. We should protect the vulnerable, but let young people, children, middle-aged adults who are healthy get the virus. They won't have serious complications. They won't die, and that's the way, the fastest way with the least economic impact we can go. As I said, that's bunk. Let me add another couple of provisions why that's bunk. In addition to it's never been shown, and it would be a minimum of about 1 million people dying. First, you can't protect the vulnerable and get to herd immunity. We have 300 million people. About 100 million, a little over 100 million, have some serious comorbidity that is likely to put them at high risk of the infection. They're over 65, they're obese, they've got cancer, they've got heart disease. You go down the list. Hard to protect 100 million people if you're going to let the other 200 million Americans get the virus. Second, it is the case that predominantly people over 65 have been the ones who have died from this illness. But predominantly doesn't mean exclusively. And if you let this a disease run through the population, there will be people under 65, under 55 who do die, and a fair number if 200 million people end up being infected. And that does seem to me a lot of premature deaths unnecessarily. So I think this is a totally misguided initiative to the extent that it's being embraced or follows the philosophy of Scott Atlas, who seems to be advising President Trump. That's a mistake. I can assure you it's not the idea that is, or ideas that is guiding Vice President Biden.
I have a question about President Trump's case. Given his comorbidity, why do you think he recovered so fast? And is the cocktail he took something that should or could be made widely available?
The short answer is we don't know. We don't know why he seemed to have had a reasonably mild case. We don't know whether that's something about him, something about the way he was treated. I don't know if he's exactly an N of 1, but he's pretty close to an N of 1. Getting the Regeneron monoclonal antibody cocktail early on so fast, it was, we don't know when he got his first positive test. They still haven't told us that information, but it was so fast, you suspect that he was positive well before we've been told, and they're just not revealing that information to us. Then he got remdesivir, and then he got dexamethasone. We don't have enough experience with that kind of arrangement to know that that's a good cocktail for everyone. Remdesivir has been approved, but it's hardly a home run. It's a pretty, I won't say lackluster, but it what it's been shown to do is shorten hospitalization. It hasn't been shown to reduce mortality, and at least some studies suggest that it's got no real benefits at all. Dexamethasone does have benefits, but that's for people on supplemental oxygen. Supposedly, the president was only briefly on supplemental oxygen, did not need it all the time. So there's a lot of confusing aspects to this. And we still don't have full data on the Regeneron studies in randomized controlled trials to know how effective, whether it's effective and how effective it is. So this is a case of where there's not enough information, and even if there were information, we don't have enough clinical trials with this combination to know whether it was a combination that helped the president or not.
And I have a question about our public health infrastructure, including the national agencies. There's been a lot of politicization, as you've noted at the top, and a lot of underfunding. Have they been deeply damaged, both in terms of top-level manpower or woman power and credibility? And do you think this is something that could be speedily reversed in a Biden administration?
They have been deeply damaged. And a lot of people within those, the CDC and other state agencies are very, very demoralized. Can it be reversed? I think it can be reversed, but we're only going to know when we try. You have to put very good leadership in, people that can command allegiance and respect and are not political, and are good managers. That's a big, tall order to get that at the top. And then you have to attract people, for all the people who have left, and convince them that this is the new normal and this isn't going to just go away shortly when people stop paying attention or a new administration that wants to politicize them comes in. So we're going to have to think of other protections that are appropriate to the agencies like the FDA, like the CDC. Famously, early on in the pandemic, I think the president said, "Oh, we know where the experts are. We can easily get them." That's bunk. You can't turn on and turn off public health measures. You have to invest in them over time. And that's, I hope, one of the lessons we've learned. Experts don't just float out. They have many, many other opportunities and effective things that they're doing if they leave government service. And by the way, there's more than just expertise. There's infrastructure that you need, technology to monitor. You need the right set of analytic skills. You need collaboration between states, localities, and the CDC. All of that has to be built up over time. It's not something you can turn on and off like you hire a consultant. And I think that has been a misnomer. I hope we've learned that if you starve these agencies, you just don't, well, we haven't had a pandemic. Why are we continuing to invest? You get, out of the blue, something happens unpredicted. That's the nature of public health emergencies. And you have to prepare for them long before the event. You can't wait for the last minute and think, well, we can throw it all together. That is not appropriate. I know that, much of what President Trump does, which is, well, we'll just do it at the moment. But that is totally inappropriate for responding to these kind of public health emergencies. Indeed, it's inappropriate for almost any serious situation, including our healthcare system.
All right, I have two last questions, one very quick and one a little bit longer. First one is, does vitamin D help?
Don't know.
And then the last question is, you were mentioning international cooperation on a vaccine. I'm wondering if you think we're going to get into vaccine nationalism, where there's going to be, competition, reluctance to share, using vaccine for political reasons. And is there a way that that can be avoided? And what should, let's say, a Biden administration do to avoid that? And what might a Trump administration do?
We already have a lot of vaccine nationalism in that a lot of countries are, taking out options or buying up potential on the hope that something, one of their bets, 4 or 5 bets will prove, or 2 of the 4 or 5 bets will prove out. And rich countries are making bets, even ones committed to not having vaccine nationalism, like Canada, have pre-purchased lots of vaccine from the big makers. The real issue is, can we preserve enough for low and middle income countries that they can also begin to protect their health systems, their vulnerable population, and can we develop a coordinated response so that in the course of the illness, we distribute it fairly among countries. Some of my colleagues and I actually wrote a serious academic paper in Science magazine where we outlined a model for fair distribution of a vaccine called the fair priority model, focusing on distributing a vaccine to countries that have serious outbreaks where the vaccine is most likely to reduce premature mortality, and then focusing the vaccine on enhancing economic recovery, where the sort of standard you want to do is using the vaccine to reduce cases of poverty within countries. That is, having a fair distribution is very important. We've circulated it. We're, getting a lot of interest in what we have to do. The WHO has its own proposal, but I think this is a major issue, and it's going to be messy. That seems inevitable. But I do think that we can be more fair in this than we've been before in other emergencies. And I think that's the big challenge.
Just a very last quick question, and we have time for a quick answer. It seems that we are faced with a choice between a continuing Trump administration and a sort of herd immunity strategy until we get vaccine, and a Biden administration with hopefully a national strategy. If Joe Biden wins, and there is the kind of strategy you described, what do you see as a time frame by which we could come through this? Would it be a quicker time frame than the end of 2021?
I think probably not, because I think the limiting factors are things that the president can probably make some change on. But, a lot of time has been spent that should have been spent solving some of these problems already. And so, President Biden would inherit a situation where he's already starting a little behind the 8 ball. There's also the limitation of production, which is not something that the president can control now. Did we set up enough manufacturing facilities? Did we pre-approve them? That, I think, may turn out to be our limiting factor, especially if it turns out that the Pfizer vaccine is the leading vaccine. Not that I have anything against them, but it does require a serious cold chain, which impacts its distribution. It requires 2 shots 3 weeks apart. It probably, given the cold chain, can't be distributed in physician offices, so you're going to have to mainly distribute it at big centers and big parking lot drive-through arrangements. That is a big set of challenges. I know the company has been really working on the logistics with others, but and then add to that the production of enough vaccine, both for the United States and other countries. I really think that we're talking fall 2021.
On that scary note, but hopefully not so scary if we have a national strategy. I just want to thank you so much, Dr. Emanuel, and thank all our listeners for joining the webinar today. And I look forward to seeing you at more webinar events after the election. And in the meantime, you can tune into the next conversation with Inquirer columnist Will Bunch on October 30th at 11 a.m. And Dr. Emanuel will all be looking for you on CNN, MSNBC, and hope there's some bit of optimism in the coming weeks.
Great. Thank you very much, Trudy. Been a wonderful interview.